I'm Dr. Dylan Marsh. I'm one of the toxicologists here at AusHealth.
I'm Dr. John Edwards. I'm the senior toxicologist at AusHealth. Today we're going to talk about the results of drug tests and what that might mean for people who are trying to explain the type of result they have. Sometimes what we see is people who fail an on-site test, and some people will then have that confirmed and they will have a result which tells us exactly how much drug is present. So can you tell us something about failing a drug test on site?
Sure, so something important to note is that in on-site testing it's quite non-specific, so it'll pick up basically any drug that looks like the drug that it's searching for. So a common example here would be someone who's taking Sudafed. Pseudoephedrine might show up on site as amphetamine, but once it goes to the lab it's going to be confirmed positive for pseudoephedrine, so it's entirely separate.
In these cases, what we might understand is that someone who hasn't been taking any illicit drugs may have a non-specific, non-negative test, and then they're concerned because they think, I'm being blamed for having positive drugs. So this positivity isn't going to be determined until it goes for a confirmation test to the laboratory.
It's also important to note here that we often refer to on-site testing as non-negative, not positive, because we don't consider a test to be confirmed positive for a drug until the laboratory itself has confirmed that.
The second type of problem we see is people who are actively taking drugs and they know that they're taking drugs, but they know that their job is on the line. So when they get a non-negative test result, they try to explain it. And sometimes these explanations make no sense at all.
Absolutely. A common example that I've seen that we get a lot is that when somebody gets a test that is confirmed positive for methamphetamine and amphetamine, for example. Now, amphetamine is a metabolite of methamphetamine, meaning that in the body, methamphetamine is converted to amphetamine. Sometimes people will say that they have a prescription for dexamphetamine, often used to treat ADHD. However, this doesn't quite stack up in the context of a drug test because methamphetamine does not result from dexamphetamine use, and there are no medications in Australia that will show up with methamphetamine.
Other people try to have a reason for their drug test result because drugs are sometimes very confusing in their naming. So whenever there is a name which is similar to that of a drug name, they try to hang on to that. So for example, if someone is positive for methamphetamine, they may claim to have had exposure to methadone, which they may have a prescription or a treatment plan for. But the confirmation test will confirm whether or not that any of these drugs are present. We had a test result recently, Dylan, where somebody claimed to be in a methadone program, but we're positive for methamphetamine. There's no relationship between methamphetamine and methadone except for the 4 letters of their name. We also were able to confirm in that particular case that the subject wasn't just not taking methadone, but they were actively taking heroin. And Dylan, what we also hear a lot of is people who are non-negative on site for opiate drugs and then are confirmed positive for morphine and they say, I've never taken any drugs. So what kind of explanation might we see here?
So something I'm sure everyone would have heard of is the poppy seed defense. Now there is actually quite a lot of truth to this statement. So when someone does consume poppy seeds, it can show up with morphine in their system, even though they may not have taken any morphine-containing drugs. However, the toxicologists here at AusHealth, John and myself, can determine the difference between medication and poppy seeds.
A very similar situation arises with THC positive results in that some people claim to be exposed to hemp seeds in their diet. Now this is also a very poor explanation for THC in a specimen because in Australia, the food standards of Australia and New Zealand require that all hemp seeds used for diet are ultra low concentration THC, which means that they're going to have no effect on a drug test.
So thanks everyone. If you have any more questions or comments, please feel free to leave them down below or on any of our social media platforms and we'll try and get back to as many as we can.